Hello, I'm Richard Kainer, Director of Treatment and founder of Brooklyn Audiology Associates.
And I'm Dr. Max Rubin, audiologist and co-owner. Welcome to Brooklyn Audiology Associates. Please watch the following video message from our colleague, Dr. Keith Darrow.
Stay tuned through to the end for an important message from us and how to get a free copy of my co-authored book.
Hi, Dr. Darrow here. Perhaps one of the most common questions that I get is, help me to better understand how I can get rid of my tinnitus. And it really is a great question. But in order to best answer this question, we have to take a step back. See, we have to first understand tinnitus. We have to start with, why do people have tinnitus? How do they live with it? What can be done about it? And of course, how do you say it? Is it tinnitus or tinnitus? Actually, either way is correct. So first, let's start off with the obvious. What is tinnitus? The definition is actually pretty simple and very straightforward. Tinnitus is a phantom sound that is heard in either the ears or somewhere up in the head. But let's stop right there. Before we go any further, you see, a phantom sound. Now, I love that definition, and here's why. Because the use of the word phantom is intentionally analogous to phantom limb. In both cases, you're sensing something that's not actually there. See, with phantom limb, it's typically described as the perception or sensation, maybe it's a pain, that comes from a missing extremity or a limb. And in both phantom limb and phantom sounds, tinnitus, these false perceptions happen when the signal to the brain is disrupted or damaged. So let's talk more about what causes that annoying ringing or buzzing or swooshing sounds. And I've heard every descriptor out there. These sounds that you are hearing are most certainly the result of damage to your auditory system. And it can even happen in people who believe that they have normal hearing. Oh, and if you actually take a look at the numbers, there are 50 million people in the United States that report having tinnitus. That number might sound familiar, as you've heard me talk in my other videos about how 50 million Americans also suffer with hearing loss. Can't possibly be a coincidence. So given that tinnitus is actually the result of hearing loss and damage to your hearing system, you would think that everybody with tinnitus has a significant hearing loss, but not necessarily. See, the problem is there are a lot of people with quote-unquote normal hearing that say they experience tinnitus. But what's really happening here is that the tinnitus is the first symptom of hearing loss, and it's really the first symptom of what is yet to come. Aha, see, I hope that makes more sense now. So even when somebody says they don't realize that their hearing is being affected, that doesn't mean that the nerves from ear to brain are not damaged. And that can result from age or noise exposure, maybe even from certain medications. So let's now focus on the medical treatment of tinnitus and how we need to approach this problem. Let's get something out of the way right now. There is no cure for tinnitus, but there are plenty of major health conditions like diabetes and hypertension and cancer that don't have a cure. But they have very effective treatment programs, just like treating tinnitus. See, today's treatment, when done correctly and when under the supervision of a trained clinician, can reduce ringing in 70 to 80% of patients. Now, how long that takes to achieve these results, well, that can vary. And it's very important to lay out that this is not a quick fix. In fact, studies have shown that the changes and adaptations in the brain sometimes are quick, sometimes minutes. My colleagues and I will all tell you that we have countless patients who say in the office on day one, wow, the ringing is gone. But there are also patients that can take a year or longer to notice the ringing go away. I'm being upfront with you because you need to have the right expectations. And look, regardless of how long it takes, it is the most effective treatment. After all, the alternative is doing nothing, and that is not acceptable. Continuing to let the ringing interrupt your sleep, your concentration, get in the way of your hearing and your quality of life is not acceptable. See, we all need to understand that the damage to your hearing system is permanent and progressive, which means it will only get worse if not treated. So, if you don't address tinnitus, It can lead to all sorts of problems like stress, anxiety, hospitalization, increased risk of falls, or even dementia, even premature death. Yikes. So let's not let that happen. Listen, when it comes to treating tinnitus, the goal is to provide the correct sound feedback that can drive the brain and give it exactly what it needs to make the ringing go away. With this stimulation, you encourage neuroplasticity to do its thing. And when dealing with hearing loss, you know there's a significant loss of neural connections from ear to brain. And through treatment, the goal is to target those remaining nerves so that you can maintain the quality of the system. Otherwise, the nerves that are left untreated, well, they're going to die too. The brain will need time to adapt to the new sound stimulation in order for you to really experience a reduction in tinnitus. They say when you know a patient with tinnitus, you know a patient with tinnitus, because each patient is unique. Therefore, each treatment plan is unique and customized. We will lay out your custom treatment plan that depends on your individual hearing loss, your tinnitus, and your cognitive needs. And again, when done correctly by the right clinician, there is nearly an 80% effective treatment rate with this process. Remember, with targeted sound stimulation and accompanying cognitive behavioral techniques, we can help to drive down that ringing for all of our patients, therefore helping everyone to live their best life. So if you haven't done so already, go ahead and read the free report I have about tinnitus. I've put this together for you. You can request a free copy of my book that details the entire process of treating tinnitus. And if you still want more to read, don't worry. I got plenty that'll keep you busy. But don't just read about it. Take back your life and turn down that ringing in your ears. Thank you, and take care.
Hi, I'm Richard Kaner, and this is Dr. Max Rubin.
Thank you very much for watching that very important message. And welcome again to Brooklyn Audiology Associates.
When I started this practice in 1980, it was founded on the core principle to treat every hearing loss, its debilitating symptoms, and the cognitive aspects associated with hearing loss to the very best of my ability. Here at Brooklyn Audiology, through over 4 decades of research and case studies, we have developed a proven process for making you hear the best you possibly can.
With the appropriate treatment, you will not only hear better, but we can help reduce your risk of the hearing loss getting worse and reduce your risk for cognitive decline. Rich and I, along with all our providers and staff, will help guide you on your journey to better hearing.
Thank you for trusting us for all your hearing healthcare needs for over 40 years.